Welcome to all of you to our 8th annual Doctors of Distinction event. I am Marcia Flug, and on behalf of D. Del Bello, our publisher, and all of us at Westfair Communications, we'd like to welcome you to the celebration. We produce the Fairfield County and Westchester County Business Journal every week, award-winning WAG magazine every month, the news at noon each day, and the many events that we celebrate throughout the year. This year, it was apparent just how outstanding our medical professionals, hospitals, and all aspects of healthcare are as they face the COVID crisis head-on while serving all of our medical needs. This year's 2020 Doctors of Distinction honorees are truly the best of the best. And as they were forced to morph, so were we. To reimagine tonight's event, because we are so very proud to share the dedication and success of our 2020 Doctors of Distinction honorees. Our judges sorted through the highest number of nominations to date. Thank you to Janine Miller of the Westchester Medical Association, Dr. Stephanie Kazantsev, and previous honoree, Dr. Camilla Lawrence, for judging these outstanding medical experts. Before our presentation portion of the program, we'd like to extend thanks to our unwavering support from our leading hospitals and sponsors for tonight's event.
Thanks to the sponsors and supporters that have made this event possible. Thank you to our healthcare leaders, White Plains Hospital, Incredible New Cancer Center, and their ever-expanding cutting-edge medical services. United Hebrew of New Rochelle, a vibrant campus of comprehensive care for seniors located in New Rochelle.
At United Hebrew, we've got it all. Independent senior housing, memory care, assisted living, nursing care, and rehab to get you on the road to recovery.
My wife and I looked at over a dozen places. This is the best one. It's head and shoulders above any other place we saw.
I personally want to come to visit my mom. It was the best decision that I ever made.
Come see us. Here's to life.
Our healthcare partners, Yale New Haven Health, the largest and most respected health system in Connecticut. Burke Rehabilitation Hospital. Burke Rehabilitation Hospital, a member of the Montefiore Health System, has been a leader in rehabilitation medicine for more than a century.
Burke Rehabilitation Hospital, a member of the Montefiore Health System, provides comprehensive rehabilitation medicine programs to patients throughout Westchester, the Bronx, and the Hudson Valley. If you have experienced a stroke, spinal cord injury, brain injury, neurological condition, orthopedic injury or illness, cardiac or pulmonary disease, or are recovering from the COVID-19 virus, Burke has a specialty program designed to help you reach your maximum recovery. Burke Rehabilitation Hospital is here to help you during each step of your rehabilitation journey. To learn more, visit burke.org.
Open Door Family Medical Center. Opened in 1972, they provide high-quality medical, dental, and behavioral health care to over 300,000 low-income patients annually, from prevention and wellness programs to the treatment of diseases. Open Door operates centers in Brewster, Mamaroneck, Mount Kisco, Ossining, Portchester, and Sleepy Hollow, in addition to 8 school-based health centers in the Portchester and Ossining school districts. New York Presbyterian Hudson Valley Hospital. New York Presbyterian Hudson Valley Hospital, part of the New York Presbyterian Regional Hospital Network. It has a long history of providing high-quality health care to residents of Westchester, Putnam, and Lower Dutchess County. A fully accredited general, not-for-profit, 128-bed hospital offering a wide range of inpatient services and ambulatory care. New York Presbyterian Hudson Valley Hospital has been recognized by numerous regional and national accreditation organizations. 3 consecutive Magnet achievements underscore the hospital's excellence in nursing leadership and innovation. New York Presbyterian Hudson Valley provides a leading obstetrics department to serve families throughout our region. Webster Bank is a leading regional bank with $32.7 billion in assets. We're a community-minded, values-guided bank focused on helping customers achieve their financial goals. Putting people first, Webster bankers take the time to understand what matters most to our customers, responding with personalized solutions and acting with responsibility, respect, ethical behavior, citizenship, and teamwork. Our bankers serve more than 3 million customers with outstanding results. These values represent the Webster way. They are at the forefront of everything we do and differentiate us in the market. Westchester Medical Center Health Network. The Westchester Medical Center Health Network, WMC Health, is a 1,700-bed healthcare system headquartered in Valhalla, New York, with 10 hospitals on 8 campuses spanning 6,200 square miles of the Hudson Valley. WMC Health employs more than 12,000 people and has nearly 3,000 attending physicians. Level 1, Level 2, and pediatric trauma centers, the region's only acute care children's hospital, an academic medical center, several community hospitals, dozens of specialized institutes and centers, skilled nursing, assisted living facilities, home care services, and one of the largest mental health systems in New York State. Westchester Medical Center is the flagship of WMC Health Medical Center and serves more than 2.4 million people. Thanks to our supporters, Gilda Bonanno, LLC.
Hi, I'm Gilda Bonanno, professional speaker and executive communications expert. Whether you need a keynote speaker, an interactive workshop, or one-on-one consulting, I'd love to talk with you about how we can bring an interactive and successful program about communications and leadership to your team or organization. And if you need a virtual program, I am a certified virtual presenter, which means I know how to create content that works virtually and then deliver it in a way that's engaging and interactive. Plus, I can help every member of your team get comfortable with this new world of virtual presentations, so their remote meetings and webinars are successful.
The Bristol Assisted Living helps families embrace advantages of assisted senior living. The compassionate, highly trained teams offer facilities in Armonk and White Plains. Caremount Medical, the largest independent multi-specialty medical groups in New York providing comprehensive medical care. Kensington Senior Living is an enhanced assisted living and memory care residence located in the heart of White Plains, New York. It is the realization of a vision of passionate leaders in the senior living industry. The St. John's Riverside Hospital network of healthcare services extending from Yonkers to the riverfront of Hastings. WestMed, award-winning multi-specialty medical practices based in Westchester and Fairfield counties. Phelps, part of Northwell Health. Phelps is a non-profit acute hospital providing extensive expertise since 1956. And thank you to Blossom Flowers for the beautiful flowers provided every day in our community. Thank you to all of our many sponsors and supporters for your continued support of our Doctors of Distinction celebration. We welcome all of you to our Doctors of Distinction virtual event, and congratulations to the 2020 honorees.
Good evening. It's with a great sense of appreciation and humility that I come tonight to accept the Biomedical Breakthrough Award. The question that I was given was what's a gratifying professional experience that keeps us motivated. I've been a doctor for close to 30 years now. What's gratifying is the explosion in technology and therapeutic approaches. But we come to this level by listening to doctors on patient complaints and being able to modelize those complaints in biomedical research. What I mean by this is to take this concept, the patient complaint, into the laboratory, biomedical research laboratories, and test cells that can reproduce this phenomenon. Develop animal models that can capitulate the disease process, and being able to test the disease into animal model and administer new and novel therapeutic approaches that are constantly optimized in this model for ultimately moving into FDA and clinical trial for testing into human, and finally being provided back to the patients. This circle coming from a patient into the lab with animal models with clinical trial and coming with tangible answers after a profound modelization of the process is probably the most gratifying experience that we have and keeps us motivated for that to being able to answer public health and issues associated with our patients.
We as physicians have the unique gift of being able to change the quality of life for those who are less fortunate. In the field of ophthalmology, this is ever more apparent as giving someone the gift of sight can alter every aspect of their existence, from their ability to work, to their standing in the community, to their personal sense of happiness, fulfillment, and well-being. I've had the opportunity to travel and work in different parts of the world and see how healthcare disparities affect different populations. I worked in a public hospital in the Middle East in an area that served as a nexus for patients from many different countries, some of whom had never seen a physician before. Across a range of languages and cultural barriers, I was shown an entirely different side of how visual impairments and disfigurements are perceived in various cultures and the many barriers that exist to treatment and follow-up. I then founded Casa de Luz with my father. This is a charitable organization that provides medical and surgical care to patients in the Dominican Republic, patients who are unable to afford care on their own. The organization has become a sustainable part of the community, returning year after year with a team of 30 providers and offering care to thousands of patients.
I am truly honored to be receiving the Doctors of Distinction Healthcare for All Award. I'm also really proud to be a physical therapist amongst this group. And I'm glad that the tremendous impact that physical therapists have on people's lives is being recognized this evening. You know, the physical therapy profession is relatively young in the big scheme of healthcare delivery, and it's really only been over the course of the last 3 to 4 decades that physical therapists have been very aggressive at doing the research and studies to collect data that help guide our decision-making in the clinic. After a short time as a physical therapist, I became fascinated in the function of the hand. It is quite a miraculous appendage to our bodies, and it really allows us to do so many things that we take for granted. Just simply buttoning the button on our shirt, or to the extreme, playing a musical instrument or becoming a concert pianist. All of us at Performance Rehabilitation, along with the physicians, work together to get people better, and I look forward to getting back to caring for all.
I've been asked to discuss what is inspiring me right now, and I'd say that what's inspiring me now is the same that's been inspiring me throughout my career. How to improve the lives of people that I'm caring for, or people in our area. And that's been the case for me in my career from the beginning of the HIV epidemic, to people with infectious diseases and sexually transmitted infections, to people with hospital-acquired infections and tuberculosis, and now with COVID-19. Third thing is that is a little bit of a selfish thing, which is it's the satisfaction that it gives me to be able to help so many people around us, and to be able to create new knowledge and create new advances. That is so incredibly satisfying that it is all the payback anyone needs. I think those inspirations will always be there.
My name is Woo-Yeon Park, Chief Medical Officer and Senior Vice President at Burke Rehabilitation Hospital, Montefiore Health System. Burke is a specialty hospital focusing on medical rehabilitation, education, and clinical research. Annually, we have approximately 3,000 inpatient admissions and 180,000 outpatient visits. During the pandemic, Burke has developed and implemented strategies to establish clinical integration with the surrounding acute care hospitals of the Montefiore Health System and beyond for the care of COVID-19 patients. We immediately recognized the tremendous unmet needs of physical, psychological, and cognitive rehabilitation of these patients. Rehabilitation of COVID-19 survivors was a new concept, and Burke was able to establish a working model of addressing these needs.
What is a female trailblazer, or what is a trailblazer? A trailblazer is someone who forges a path through a wild country, or an innovator, or a pioneer. While I don't think that I've been traveling through a wild country, I do think that my journey has not always been the easiest. Working as a female medical student and doctor in the 80s and 90s was not always the easiest. There clearly was some discrimination, and I'm glad that my current colleagues and female medical students are not experiencing that discrimination. I feel really lucky to have entered the world of genetics at the time that I did.
Really being a healthcare executive and receiving these awards is a reflection of your team. I work with a tremendous team here at Caramount, very intelligent people, and I learn something new every day, which is ideally what a physician wants to achieve. One of the questions that they asked us to answer is, give a defining moment in your life which brought you to medicine and to become a physician. One of the two key jobs that I've done, one was working in a lab doing diabetes research. I spent the next summer working in a nursing home. And the key to that job, and what I loved about it, was the relationships that I developed with the residents in that home and the people that I served. And that's truly what medicine brings. And as an internist, I really have that, where you have those long-term relationships with patients. You're an integral part of their life through thick and thin, and you also get the science and the learning that comes with medicine.
It is employees like ours who show courage and generosity in taking care of our patients, providing them with the highest quality of care to make sure that they and their families are safe. I'd also like to take this opportunity to thank all of the other honorees for everything they have done to advance healthcare in their communities and throughout the state, and doing the best they can to make our place a safe community.
My courageous maternal and paternal grandfathers, who immigrated to the United States from Italy, were my inspiration and motivation to pursue a medical career with an ardent desire to assume greater responsibilities and a passion to care for others. 40 years ago, I was recruited by Dr. Louis Del Guercio, the chairman of surgery at New York Medical College and director of surgery at Westchester Medical Center, who became a mentor in my development of an academic, surgical, and research career. And I will always remember his fairness and dedication to caring for all human beings, irrespective of their socioeconomic status. Lastly, and most importantly, I want to thank my wife Gay and my two daughters, Margaret and Carly, for their unconditional love and support over the years, and always being there for me and encouraging my surgical endeavors. Another Lifetime Achievement Award is coming in November with the birth of our first grandchild.
Thank you to the organizers for hosting this event and for the award that I'm receiving. In these trying times, I should share this recognition with many others who are just as deserving of it. When I think of the 7 years spent working in Africa and then 20 years caring for vulnerable patients and families, one effect of working overseas is that you return home to feel a bit foreign in your own land. Please send your children to study and volunteer overseas, COVID-19 permitting. The international contacts made through organizations like the Peace Corps bring just as much benefit to the volunteer in this country as it does to host nations. Seek to travel off the beaten path to experience how the rest of the world lives. And finally, encourage the study of foreign languages, which opens the door to connecting with other cultures on a truly personal level. Surely enough, no land is too far. And as Robert Louis Stevenson said, there are no foreign lands. It is the traveler only who is foreign.
Hi, I'm Dr. Jason Schuker, Associate Medical Director for the Urgent Care Department at WestMed Medical Group.
And I'm Dr. Jennifer Johnson, Family Medicine Physician at WestMed.
We wanted to take a moment to say thank you for the Doctors of Distinction Power Couple Award.
We feel honored to receive this recognition.
The COVID-19 pandemic has highlighted how gratifying and motivating our professions truly are.
Being able to guide and counsel patients through the scariest and most uncertain times in their lives is both rewarding and humbling.
We are most grateful for the trust our patients put in us.
That is what keeps us going. Thank you so much.
I was asked, what is the defining moment that drove me to pursue a career in medicine? I can't think of a greater example than what we're currently going through in the midst of this pandemic. There's still so much uncertainty and so much unknown surrounding COVID-19, but it's been truly inspiring to see the amount of sacrifice the healthcare community has made in the service of others. I strongly believe that we have duty towards others, and that's why I'm excited to be pursuing a career in medicine, where this is the way.
When I was told I was to be awarded for the Support Staff Award for going above and beyond during such an unprecedented time, 7 months ago, most people outside of healthcare didn't even know what respiratory therapy was. And because of this pandemic, we were thrust into the spotlight, for a lack of a better word. I was asked, what makes you committed to the passion and passionate for your current specialty? And I have to say, it's the patients. During this past year, I've experienced some of the lowest points of my healthcare career. But just like all the rest, I went to work every day and helped the ones I could. And now when I receive pictures, letters, and visits at the hospital from the patients who have gotten better and come in to say thank you, it always renews my passion and dedication for my field and love of what I do.
The COVID-19 pandemic has been like nothing we've ever experienced before. It's because of teamwork that we've been able to keep ourselves safe thus far. We've always believed we have a responsibility to keep our community safe and healthy. We did just that. What was unexpected was the outpouring of support we received from the community itself. From the firefighters clapping for us on Thursday night, to the mayor joining our Zoom calls, to the businesses who provided us food on a daily basis. And don't forget the touching letters that we received from the neighborhood children. Inside the emergency department, what kept us motivated was the support we provided to each other. This team award is fitting because it represents who we are.
Hi, I'm Dr. Joe Feuerstein. I am the Director of Integrative Medicine at Stanford Hospital and one of the team at the Center for Integrative Medicine at Stanford Hospital. You ask us why we're so passionate and dedicated to our jobs and why we work so well together as a team. It's because we see the patients who have nowhere else to go. We see the patients who've already seen all the other doctors. These are the hardest cases. These are the people with chronic pain, with pelvic pain, with irritable bowel syndrome, with anxiety and depression. And they've been worked up. They've seen all the doctors. And then they come and they see us, and we use the world of nature. We use compassion and care together as a team to really help bring them back, to move their whole picture of illness into a wellness picture. And so it's really an honor to work with all of my colleagues. It's an honor that our team together does incredible things. We're one of the largest integrated medicine centers in the country, and we're going from strength to strength. Thank you so much for this great honor.
Hi, I'm Dr. Mira Garcia. I'm the Division Chief of Obstetrics and Gynecology here at New York Presbyterian Hudson Valley Hospital. We are a diverse group of physicians and midwives who work to provide seamless, compassionate, empathetic care here in Hudson Valley. We care for women of all ages, cultures, and diversity, and we work to empower, to educate, and to protect women. What motivates us to keep going forward? Our team works together, and we are excited about our new maternity center that's opening this fall.
My name is Dr. Meadlin Charles, and what inspires me here at the New York Presbyterian Hudson Valley Hospital is to help women take care of themselves through education and support.
Hi, my name is Matthew Cantor. I'm an OBGYN at New York Presbyterian Hudson Valley Hospital. What inspires me to keep moving forward? I really enjoy striving to provide an academic standard of care in our community hospital, which provides a lot of support and sort of a community feel during women's experiences here.
Hi, I'm Dr. Lisa Mcleod. What inspires me to keep going forward is the relationships that I've created here. It's great to have a continuity of care and to see patients that are well cared for throughout their hospital course. So that's really inspiring.
My name is Joanne Manito. I'm a certified nurse midwife. I am thrilled to be a part of this collaborative practice of physicians and midwives who really strive to provide the highest level of care, taking in the talents and expertise of each individual provider in the group and working so beautifully together to meet the needs of women.
At White Plains Hospital, the innovation team is future-looking and believes in utilizing technology in the ways best possible to serve our patient population and to help our clinicians deliver the highest quality care possible.
To be exceptional every day, we look to drive higher patient experience and access to all of our patients, virtually and on site.
One of the things that drives us in innovation is we are totally devoted to transformation of the lives that we touch here in the hospital and beyond the medical community.
Our hospital 125 years ago was started as a small home, and clinicians went into the home and delivered home care. Really, this is just full circle, us going back into our patients' homes, delivering care and meeting the needs where the patient is, especially when they're isolated in the time of a pandemic.
Hi, my name's Joe Malloy, and I've been a proud counselor for over 30 years in the addiction field. I figure we need to develop a safe place, free of harm, where our folks can come and get treatment. Well, guess what? I found through this telehealth services, we just have to do it differently. The folks I work with have made me proud, so proud to be in this field and to work where I do.
My name is Valerie and I'm a K-SAC here at Phelps. Our leadership has definitely been an inspiration as well for us to provide the best services to our clients.
I'm Dr. Mark Westikoff. I'm the psychiatrist at Phelps ATS. I didn't imagine in the beginning of March that within a few days we'd be switching the way we provided care. The institution stepped up to the plate, gave us the equipment we needed, and I think we turned out doing an excellent job of it collectively as a team.
I'm Karen Gottlieb, Executive Director of AmeriCare's Free Clinics. AmeriCare's Free Clinics provide quality health care to low-income, uninsured patients, all at no cost. Without our clinics, many patients would forego or delay care until they have a medical emergency. When the coronavirus pandemic reached Fairfield County in mid-March, we knew we had to continue to take care of our patients. So we quickly pivoted to telehealth. Staff at the Fred Wiseman AmeriCare's Free Clinic of Bridgeport knew one of their patients, Mateo, wasn't feeling well. At the time, COVID tests were scarce, and Mateo didn't meet CDC criteria for testing. But when Mateo joined a regularly scheduled telehealth session, our healthcare providers saw his illness had worsened and immediately referred him to a local hospital. In the hospital, Mateo's condition deteriorated. He was placed on a ventilator, but slowly Mateo's condition began to improve. After 28 days, he came off the ventilator, and today Mateo is home with his family. Telehealth saved Mateo's life. Going above and beyond, the staff made sure patients had essential medication refills and isolation bags to protect themselves and their families while at home.
Although we share similar values regarding the meaning of family, our defining moments that brought us into medicine were quite different.
My parents, who were both World War II orphans, gave me a lot of freedom to explore my own ambitions. However, they said to remember 3 key points. Every encounter is a learning opportunity. Respect people as if they were family, and always follow your heart. And with that background and advice, a doctor was born.
Unlike my husband, I didn't always want to be a doctor. Like many young girls, I envisioned myself becoming a ballerina or a gymnast, an artist or a writer. It wasn't until college, when fulfilling my course requirements, did I stumble upon the beauty of science. I had chosen film studies as my major in college and ultimately earned a BA in this. But what I loved most was cinematography, being behind the camera, able to observe the nuances of people and humanity. As I continued along the science path, skipping through biology, chemistry, physics, and the plethora of pre-med classes, I realized the strong similarity between my major of film and science and medicine.
Finally, a special shout out to Dina, my real heart doctor, and literally my right arm. And my 2 awesome children, Cole and Chloe, who are both, of course, pre-med.
I guess it's genetic, or it's all in the family.
Stay safe.
We also want to congratulate the COVID-19 heroes.
This award goes to a heroic frontline worker who worked